Extract 1. Questions 1 to 12. You hear a gastroenterologist talking to a patient called Simon Mortlake. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Now, Mr. Mortlake, I think you've been referred by your GP. I've got your notes here, but perhaps you can tell me in your own words what seems to be the problem. What's brought you here today?
Sure. Well, it's not the first time I've been to this clinic. I was referred to one of your colleagues about 3 years ago. I had what I thought was a stomach ulcer, which had been troubling me for some time, and my GP suggested I came in for tests. And I had what he called an endoscopy, you know, where they put a tube down your throat and have a look at your insides. And as part of that, they also did a biopsy to make sure it wasn't something more serious.
That's right, and that was clear.
Yes, it was, fortunately. I actually had a condition called Helicobacter pylori, and I went on a course of tablets for that.
Right.
It was cleared up in no time, very straightforward. But the consultant did say that I needed to be alert for any further symptoms. You know, that there's a greater risk of cancer developing after you've had that, and that I should come straight back if I had any problems.
Oh, indeed. And have you had any other medical problems since then?
Well, a couple of years back I had a hernia operation. That was also very straightforward. I had that done just after I retired. I expect it was actually an occupational injury of some kind because quite a few of my colleagues have had similar problems.
Okay.
I was a police officer for most of my working life. Other than that, I keep relatively fit. I'm not taking any medication for anything. I've been well until just recently.
Okay. So what's happened to change that?
Well, I've started to suffer from indigestion, particularly after lunch or dinner. I get heartburn, you know, pain just here.
I see. And are there any other symptoms?
Well, I've also found myself running out of energy. I'm a keen gardener, and I'll be digging or whatever, and suddenly I feel a need to take a rest. I mean, that's not like me. I usually want to finish a job once I've started it, you know. But if I try to push myself too much, I start to get breathless, and that's a bit worrying, to be honest.
I see. And are you aware of your weight changing at all?
Not really. But what I have noticed is that I just don't seem to have such a good appetite anymore.
Right.
I mean, that's partly being retired, I'm sure, but I do keep pretty active. It's just that I don't fancy the sort of big meals I used to eat. I start to feel sick if I have too much.
And are there any other pains or physical symptoms?
Not really. I've been looking out for things like my stomach swelling up, because I know that might be a symptom of something. But to be honest, I can't say I've ever had that.
So what do you think might be the problem?
Well, the thing is, my uncle, that's my mum's brother, he had to have a gastrectomy. And I remember this is how it all started. I mean, the symptoms I've described, and, well, I think these things can run in families, can't they?
Well, they can.
Anyway, the real reason that I want to get checked out is because I've got a big trip coming up. The wife and I have booked tickets on a cruise to Antarctica. I mean, it's the trip of a lifetime. We're really excited about it, but I need to make sure I'm well.
Okay. Well, I understand your concern. So what I need to...
Extract 2, questions 13 to 24. You hear a physician talking to a patient called Mrs. Crome. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning. Please be seated. May I know your problem?
Well, I feel that I have jaundice and a pancreatic mass, and recently I've noticed a new murmur, bacteremia, and fever.
What's your age?
64, doctor.
Okay. Do you have a cardiac history, or else any shortness of breath called orthopnea, or attacks of severe shortness of breath and coughing at night called paroxysmal nocturnal dyspnea?
No, doctor.
Are you getting chest pain, palpitations, or syncope?
No, doctor.
You have any past medical history?
I had diabetes, hypertension, and transient ischemic attack long back.
Okay. What medications are you taking?
Acidophilus supplement, cholestyramine, Creon 20 3 times daily, Diovan 160 milligrams twice daily, Lantus 10 daily, Norvasc 5 milligrams daily, Novolog 70/30 10 units at noon daily, Pamelor 15 milliliters every evening, vitamin D3 1 tablet weekly.
Are you allergic to any medication?
I'm allergic to codeine, Coreg, and vancomycin.
Is there any family history of illness?
While my daughter has a history of a murmur, my father died when he was 75 due to chronic heart failure.
Okay. Well, your laboratory data shows sodium 133, potassium 2.8, chloride 99, bicarbonate 31, glucose 75, BUN 12, creatinine zero point 0.8, calcium 8.6, total bilirubin 3.2, AST 63, and ALT 43, white count 5.4, hemoglobin 9.1, hematocrit 26.6, and platelet count 128,000, lipase less than 10. Your abdomen CT diagnosis shows a pancreatic mass with biliary obstruction. Previous biliary stent is present. Your electrocardiogram shows normal sinus rhythm. There are no acute ST-T changes. Your temperature is 98.8, heart rate 96, sinus blood pressure 138/55, respiratory rate 20, and oxygen saturation 92%. You have newly developed murmur that has occurred in the setting of fever and bacteremia. You also have a pancreatic mass with jaundice, hypertension, hyponatremia, and hypokalemia. Take Diovan and Norvasc for blood pressure control. I recommend that you should undergo an echocardiogram. This will be to assess the possibility of endocarditis, which may be contributing to these symptoms.
Part B, questions 25 to 30. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. Now look at question 25. You hear a nurse reporting to a medical team about a patient. Now read the question.
We have one geriatric patient, Mr. Drake, in room 242. He's had 2 strokes in the past, and there's some cognitive impairment. The reason he was admitted from his nursing home yesterday was essentially that he's been refusing food for 3 days. But there are definitely signs of depression. Last night, the duty nurse reported that he was saying, "I want to die, I want to die," though he didn't say this to me personally. Apparently, his wife's in another nursing home. They have no contact, and she's not been able to visit him. So we're going to try to figure out how to get them together, because that'll give him something to look forward to. In the meantime, the plan is to get him up. We'll start with the cardiac chair until physiotherapy can see him.
Question 26. You hear a hospital nurse talking to a patient about oxygen therapy. Now read the question.
Mr. Anand, here's the oxygen mask, which we agreed would be a good idea while you're having breathing problems.
Oh, thanks.
Now, it's really easy to operate. Have you used one before?
Yeah, at home last year for a fortnight. I think I remember what to do.
Good. So you're aware of the effect on your mouth?
I'll keep drinking a little and often, because otherwise the oxygen can dry it out, can't it?
That's right. You've got to keep hydrated, so do shout out if your water jug needs refilling. Do you have any other concerns?
Well, last time the skin here, behind my ears, got quite painful and raw because of the elastic straps tight against it.
Well, if you use these little pads and loosen the straps, it'll stop that happening.
Great.
Question 27. You hear a surgeon briefing her team about a patient they will operate on later in the day. Now read the question.
And the next on today's list is Freddie, who's a cloacal extrophy with a cross-fused ectopic kidney. He has a history of respiratory infections too, and there's a high risk of him getting another one following the procedure, so he'll need to be in the intensive care unit. We obviously can't start until we hear there's a place for him there, but they're calling us shortly and they sounded pretty positive this morning. This is today's main case, and I'd like to get started around midday so we can spend the whole afternoon focused on this.
Question 28. You hear 2 hospital nurses talking about a patient's medication. Now read the question.
Now, Mrs. Thompson here needs IV administration of her antibiotics.
Okay, I was a bit worried about her swallowing reflex actually. She's hardly touched her food since she came in. But she's been assessed by the therapist, who said there wasn't a problem.
She's been unable to keep anything down since yesterday morning anyhow, so there's no point trying to give her the tablets.
I see her operation's set for Friday morning, so she won't be able to eat in any case in another 72 hours. But that still gives us a window for the antibiotics. We'd still better use IV to be on the safe side.
No problem. I'll set up the drip straight away.
Question 29. You hear a pharmacist talking to a customer about head lice in children. Now read the question. Hello, can I help you?
Yes. There's nits going around my son's school. I need something that'll stop him getting them, because they spread like wildfire, don't they?
Has he got any symptoms? Has he been itchy or had a rash?
I'm not saying he's got nits, it's more that I want to make sure he doesn't get them.
I understand that, but unless your son's been confirmed as having head lice, it isn't advisable to use medication.
I was told there was a lotion you could buy over the counter. I mean, if the nits jump from one kid's hair to another, it's only a matter of time. What's the point in waiting?
Well, first of all, they don't jump. To get head lice, your son needs to be in very close contact with another child who has them. Even then, it's by no means a foregone conclusion. Also, if they're detected early enough, you might get rid of them by combing alone. If that didn't work, well, then we'd recommend a lotion. Question 30. You hear an ophthalmic consultant giving feedback to a trainee who has just carried out an eye examination. Now read the question.
So, were you happy with the examination?
I think it was okay overall, but it was hard carrying out the procedures while having to deal with the patient's questions at the same time.
Yes, that can be hard. But there were lots of good things. Reassuring the patient when necessary certainly helped the process. The patient seemed rather confused sometimes about what you wanted him to do, though. That's something to work on. Think about effective ways of communicating what's required. You described in full the reasons for the various procedures, and adapting your language style to this particular patient did seem to relax him. That sort of approach puts patients at ease.
Right, thanks.
Part C. In this part of the test, you will hear two different extracts. In each extract, you will hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer, A, B, or C, which fit best according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1. Questions 31 to 36. You hear the doctor's lecture on coronary artery disease. You have 90 seconds to read the questions 31 to 36. Coronary artery disease, also called atherosclerotic heart disease, is caused by the accumulation of atheromatous plaques within the walls of the coronary arteries that supply oxygen and nutrients to the myocardium. The condition is also called coronary heart disease at times. Although coronary artery disease is the most common cause of coronary heart disease, it is not the only cause. Coronary artery disease is the primary cause of death worldwide. While the signs and symptoms of coronary artery disease are seen only during the advanced stage of the disease, Most patients with coronary artery disease show no symptom or sign of the disease for decades, as the disease keeps advancing before the first onset of symptoms of an acute myocardial infarction, a sudden heart attack, finally arises. After decades of development, some of these atheromatous plaques may rupture and, along with the activation of the blood clotting system, begins to control the blood flow to the myocardium, causing sudden death. This disease is also the most common reason of death over 20 years of age. According to prevailing trends in the US, half of healthy 40-year-old males will develop coronary artery disease in the future, and 1 in 3 healthy women of 40 years. The Guinness Book of Records show that Northern Ireland is the country with the most occurrences of coronary artery disease. Contrarily, the Maasai of Africa have almost no coronary artery disease. As the severity of coronary artery disease develops, there may be almost complete obstruction of the lumen of the coronary artery, totally restricting the flow of oxygen-carrying blood to the myocardium. Patients with advanced coronary artery disease typically have suffered from single or multiple myocardial infarctions and may have symptoms and signs of chronic coronary ischemia, including symptoms of flash pulmonary edema and angina at rest. A careful distinction should be made between myocardial infarction and myocardial ischemia. Ischemia means the amount of blood supplied to the tissue is insufficient to meet with the needs of the tissue. When the myocardium becomes ischemic, it does not perform optimally. When a maximum portion of the myocardium becomes ischemic, there can be difficulties in relaxation and contraction of the myocardium. Myocardial ischemia can be reversed if the blood supply to the tissue is improved. Infarction means the tissue has undergone irreversible death due to the lack of adequate oxygen-rich blood. A patient may develop a rupture of an atheromatous plaque at any stage of coronary artery disease. The acute rupture of the plaque may result in acute myocardial infarction.
Now look at extract 2, questions from 37 to 42. You hear a doctor briefing his juniors about blood transfusion. You have 90 seconds to read questions from 37 to 42. Extracting blood or blood components products from one individual and inserting them into the circulatory system of another individual is known as blood transfusion. Therefore, the blood transfusion can also be considered a form of organ transplant. Generally, it is performed as a treatment for different medical conditions, such as massive blood loss due to surgery, trauma, shock, and other conditions in which the body tissues are not oxygenated adequately, where carbon dioxide or other toxic materials are not effectively removed, and where the red cell producing mechanism fails. Great care should be exercised during a blood transfusion to make sure that the recipient's immune system is compatible with the transfused blood, and also that the donor's immune system is compatible with the recipient's immune system. Moreover, blood type classifications A, B, AB, and O, and the rhesus factor classification, positive or negative, should be verified. Nowadays, a number of tissue type factors are also considered to determine histocompatibility. These tissue type factors become increasingly crucial in patients who receive many blood transfusions, as their bodies have to develop increasing resistance to the transfused blood. Depending on the needs of the community, at the time only parts of the blood are taken for transfusion. Blood is composed of red blood cells, platelets, and plasma. The platelets and plasma can be donated separately in a process called apheresis. In this process, blood is separated into components after being extracted from the donor. For instance, albumin protein is transfused for treating burns, and platelets used for treating hemophilia, cryoprecipitate, and immunoglobulin antibodies are transfused for treating immunological disorders. There will not be transfusion-related risk factors for the blood donor while transfusing the whole blood, besides the minute chance of infection or injury to the site. However, this is a certain risk to the donor when he donates plasma and has red blood cells reinfused. However, this risk is preventable by following appropriate sterilization procedures. Significantly, it has caused severe public health hazards in China, where they were often unregulated. The plasma collection centers of the U.S. are the best known examples of safe apheresis donation, which is maintained by pharmaceutical companies, involving paid donors up to twice a week. Interestingly, veterinarians occasionally perform blood transfusions to animals. Different species require different levels of testing to ensure a compatible match. Cattle have 11 blood types. Cats have 3 blood types. Dogs have 12 types of blood. Pigs have 16 types, and horses have 34 types of blood. The experimental and very rare practice of interspecies blood transfusions is known as a form of xenograft.